This week on Medical Mondays, powered by First Care Solutions, this week we chat to Dr. Yanga Madlala as well as Dr. Jessica Voerman. We unpack the power of CareFirst virtual healthcare. In the studio, in our little goldfish this afternoon. Doctors, welcome. Hello, everybody. Dr. Yanga Madlala and Dr. Jessica Voerman from CareFirst Virtual Healthcare. I'm going to split the questions between the two of you. So I brought extra plastic bats in case you want to hit each other for who wants what question.
Oh, thanks for having us, Paul. Always good to be here.
Right? I mean, how nice is this weather outside? Happy first of spring, by the way.
Thank you.
There we go. Now all the summer illnesses start. So.
What would that be?
Well, you just wait to listen in. You'll soon find out.
Right, let's jump in very quickly. Dr. Yanga, for someone using the CareFirst platform for the first time, what happens step by step? And on a busy Monday, how long do most people wait to speak to a clinician?
Okay, as just said, thanks for having us. So essentially, the first step would be booking the appointment.
Yeah.
All right, and you do that online.
Mm-hmm.
You can either download the app or use a web browser.
Okay, cool.
Then it will prompt you in terms of, okay, what kind of consultation do you want to book? Do you want it instantly or do you want to book it for later on?
Okay.
Perhaps you can't book now. And do you want a a video or a telephonic consultation? And then once your consult is booked, a member of our admin team will reach out to you, confirm all your details, and ensure that everything is above board. And then we call you or video call you.
Okay.
And then in terms of on a busy Monday, so this is specifically to speak to the guys that would book instant consultations. So generally there are a few doctors that work on the platform at any time. Even if you book your instant consultation and you don't get called, a doctor joins immediately at the second you book it. I'd range and say within 10 minutes somebody should reach out to you.
Gee, that's a good turnaround time.
Yeah, definitely. But to a max of 20 minutes, if it would get to 20 minutes, then our admin team would let you know.
Okay.
There's a little bit of a delay. But yeah, generally it doesn't go beyond 20 minutes.
And I believe you guys have a whole bunch of through your camera lens. You guys have got software that can give you your sats and all that kind of stuff, so that the doctor is prepared. Okay, all right. Dr. Voerman, I know you said something else. Didn't you say Dr. Voerman?
I've been called stranger things up.
Give us two quick lists. 3 signs you'd say yes, virtual health is perfect, and 3 red flags that you tell me to go in person immediately.
Great question, Paul. So the first one, the yes, definitely. So for a mild symptom. So anything from a rash, colds and flu, UTI symptoms, STI symptoms that you're too shy to see someone in person.
Okay.
Perfect for virtual healthcare. Then the second one I always think is very valuable is chronic disease management. So we can always help out with a 1 month script if you can't get to your usual doctor.
Yeah.
And then the last one I would say would be if getting to a doctor is difficult for you. So, you're remote, you're in an area outside of where you usually are.
Okay.
It would take you hours to get to a clinic or to a doctor in person. Those would be my top 3 reasons or best use cases for virtual healthcare.
Okay.
And then the no is, they're the ones that seem obvious to me, but, it's always good to kind of talk about it. And that's the severe symptoms and things like chest pain, shortness of breath, seizures, all the things that you may consider calling an ambulance for. That's definitely, we can certainly help you while you're waiting for an ambulance, but not appropriate for a consultation. We're not going to be able to do the full investigations that you're going to need.
Okay.
And in the same way, anything that's going to need a procedure. So let's say we're cutting an avocado and now you've cut your hand open. We can tell you, what to do in the moment to try and stop the bleeding, but you're going to eventually need stitches, and that's something we obviously or not yet can find do yet over virtual consultation. So that's when I would say. Or the last one then for the third would be if you've already consulted and there's no improvement in your symptoms, then you're going to need further workup.
And from a perspective of are there things like, and I'm probably jumping the gun here a little bit, but you said a once-off script, right? What about if they need more than one script? Would they then have to go to an actual physician?
Yeah. So the way we look at chronic conditions is that CareFirst focuses on acute general practice. So when you're looking at your diabetes, your hypertension, your chronic disease management, every 6 to 12 months, there are investigations that are needed to be done to make sure that someone is still on the appropriate medication, not worsening, not needing further tests. So from our perspective, it's quite difficult to send you for those. We can, but it's quite challenging to do that and then follow up and make sure that you've gone for those rather than seeing someone in person and doing it on the spot. So, but however, people find themselves, they've just realized they've run out of their chronic script, and now if you're not taking your insulin, your sugars are going to spike, so then we're going to have more problems. So that's the kind of scenario that we can help with, is that rescue script.
Okay, that's good, because then at least you can get to your doctor straight after that.
Exactly.
Excellent. Dr. Yanga, for fever, rash, or ear pain, what could parents check on a video call that actually helps you, and where do you sort of draw the line and say, clinic now?
Okay. I'd say the first thing with the kiddies, very helpful to have the child there.
Okay.
Yeah, we've had some instances where maybe the child is at school, the parents at work, and they've been told, okay, no, the child is unwell. These are the symptoms, and then sometimes it helps us. If the child is there, we can help you look for certain things.
Okay.
Right? So the major things are things that would need sort of emergency or acute care. So things like looking for signs for respiratory distress. So you can guide the parent to look for, is the child having fast breathing, any nasal flaring. They're holding the child, it's a young baby, does their head bob up and down?
Okay.
Then in that instance, we say, immediately to the clinic.
Okay. What is that indicative of?
Of respiratory distress.
Okay, respiratory distress.
That's the one. So gastro symptoms, the child's vomiting continuously, not able to take anything in, keep anything in. That then would, also be an indication straight to the clinic. Okay. Fever and rashes. It does get difficult sometimes over video, depending on signal, pixelation, different mediums that they're using to consult. So in that event, we do encourage them to take the video or take an image, send it to us, and then we can look at it in more detail and just have a discussion and a management plan.
Is that immediate? Can you send that attachment while you're on the consultation, or do you kind of have to do that afterwards or before the time?
So what generally happens is if it's something we need to see, and say it was a telephonic consultation, I'd give the patient a number to take down. It's our office phone, and then tell them to take an image. If they have it on hand, it's much quicker.
Okay, gotcha.
This comes right through while we're on the phone.
Oh, wonderful.
If not, then we ask them, okay, do take the image, and then we'll call you back once we receive it and chat.
Geez, that's very efficient. Gee whiz. Dr. Voerman, diabetes, high blood pressure, and asthma. What does the good virtual health check-in look like, and how do you keep people on track between visits?
So I think we answered this quite nicely earlier, that our focus is the acute setting. So we're not really looking to manage chronic conditions. But if, for example, we did have someone who is looking for a repeat script of their chronic medication, we may ask things like, what was your latest sugar reading? What was your latest blood pressure reading? When was the last time you had a seizure? That sort of thing, to kind of guide us on, is this something that's appropriate for virtual healthcare?
Yes.
Is it safe for me to give this person who I don't know at all? I don't know their medical history, how brittle their disease is or anything like that. Is it safe for me to issue them with the script? So that's kind of what we would do on our side.
Okay. When we come back, we can take a little music break, because I see we all need some water, because it's very hot outside. When we come back, we can tell a little bit more about prescriptions, medical aid, and all that kind of stuff. So don't go anywhere. If you have just tuned in, good afternoon. Welcome to the Midday Exchange. It is Medical Mondays, powered by First Care Solutions. Don't go anywhere. We'll be right back shortly after this. 25 minutes after 1. No easy way out. Robert Sepper. Welcome to First Care Solutions. Powered by First Care Solutions is Medical Mondays with Paul Angel on the Midday Exchange. Chatting with Dr. Voerman and Dr. Yanga about virtual healthcare. Right, let's get back to it. Dr. Yanga, can you send e-prescriptions, sort of blood test forms, x-ray referrals straight after the call? How quickly are they active, and can these meds that you guys prescribe, can these meds be delivered?
Yes, in short, for all of the questions you posed, yes. So yeah, we can send through prescriptions, referral letters, both for lab investigations as well as to other specialists. Yeah. Radiological investigations like X-rays and that, difficult because if they do find something, a fracture or anything like that, or don't find anything, then you need to send the patient for another investigation. Though it's difficult if you haven't examined the patient to send a patient through for X-ray imaging and things like that. And in terms of how quickly they're active, as soon as I get them.
Brilliant.
Yeah.
How efficient, or sort of not only how efficient, but where is the line where you go, okay, guys, there's only so much we can do as far as radiology, imaging, all that kind of stuff. Where do you go, this is the line, we can only do so much before you go, you need to see somebody in person?
Look, for major injuries, that's the case off the bat, that that needs to be seen and examined by someone. You're not gonna even waste time. You can't put weight on your foot, or like Jess had mentioned, there's an open AA. That we aren't going to waste time, send you straight to to be seen in person. Okay. In terms of lab referrals, if we're feeling like we need the result soon, right, then because there's a waiting time, you can go to the lab and only get the result and get check it the next day or whatever. That instant, definitely rather go in and be assessed in person.
Makes sense. Dr. Voerman, where does medical aid cover usually kick in? What might one pay cash, and do you show the fee upfront before I book?
So it's very variable on the medical aid that you're on. And luckily CareFirst is very simple to use. And you're made aware of the costs that's involved before you actually have the consultation. And that cost also can vary depending on what you want to add to your consultation. Because you might want to, it might not include the vital scans, you might want to add that.
Yes.
It might not yet include the acne scan, you might want to add that. Various things that you could add and sort of tailor the package to what you want for your consultation. But once you've paid, you are then able to have your consultation directly with the doctor. And whether your medical aid will allow you to claim back afterwards depends on the medical aid that you're on and what their virtual benefits are.
All right. Dr. Yanga, who can see my notes? How long do you keep them? And can my own GP get a copy easily with my permission?
So in terms of who sees the notes, so the doctor that would have obviously spoken with you, any other doctor working on the platform. The notes are kept the electronic medical records platform, which are all password encrypted. So only the doctors and medical professionals have access to that. And that also makes it easy for, if you consult again, for the next doctor to know how far the management plan is.
Yes.
And absolutely, we could email it to your own physical or
your own doctor. Well, that's very helpful, because I mean, you might not be able to the next time you need to go to the doctor. You might not be able to see somebody online. I mean, what happens in the case? I just thought of this right now. What happens if you want the doctor who's on virtual healthcare to be your physician? Like, just that guy.
Well, you're welcome to consult as many times as you want with that doctor. But we are all, practicing virtual healthcare.
Okay.
So we're not working in our own practices. We're not working in person. So you would consult with us. You can always call in and see when we're on duty. So that you get that specific doctor, if that's what your heart desires.
Okay. It's late, or it's the weekend. Your plan? What's your plan for urgent messages? How fast do you call back, and what happens if my Wi-Fi drops mid-visit?
So on CareFirst, we're 24/7. So there will always be a doctor on duty to assist someone. In certain busy periods, as Yanga spoke about Mondays earlier, certain busy periods we have more than one doctor, and we We review our resources weekly to see where do we need to add, where can we move those resources around to make sure that we've got that extra cover as needed. Because we don't want people to wait.
Yeah.
And, if all the doctors are busy, we do have a process where our administrators will reach out to you and say, look, all the doctors are busy, and that can be, 4, 5, 6 doctors all at the same time.
Sure.
And they'll offer to make a scheduled booking for you at a convenient time, or to say, look, the doctors will get to you. We just, there's just a bit of a waiting period right now at this moment. So we do get hold of you. If your consult drops midway, we have all your contact details. You shared that with us when you onboarded, so we will contact you back. If someone's making if someone's made a booking and they're wanting assistance, it's not that oops, I pressed the wrong button. So if you do drop halfway through, we do give you a shout back.
So it's not like you guys have to make us pay all over again.
No, we wouldn't do that. If that was the case, then we would usually ask, and you say I have paid already. We would usually ask, but just send us proof of payment. It hasn't come through yet on our side, that sort of thing. But that's a very quick, easy fix to get someone to seeing the doctor.
Interesting. Okay. Doctor, last question for you. I don't have a camera. I have a small phone. Or I'm trying to help Gogo Nkulu. Can we switch to voice or WhatsApp photos? Can a family member join the consult?
100% yes.
That's amazing. I love that.
Yes.
Because I said it right, by the way.
Yeah, we definitely.
Gogo Nkulu.
Yeah.
Yes. Not that.
Yeah, no, we're very accommodating in that way. And as I'd mentioned earlier, when you are booking the consult, sometimes people even struggle, using the online form. There is a number to dial, and somewhere can, guide you through it telephonically as well. And definitely, your family member is allowed to participate in the consultation to assist you.
Just in case you need that reassurance from somebody close by.
Or someone to tell more of the story.
Yes, so someone who will have access for the emails to come through. We do make concessions sometimes when people don't have that. We send it to their WhatsApps in special cases. We do make those concessions and
excellent.
Accommodate.
Sure, it's very convenient. It's amazing. I went through a sort of brief tour of it a while back. I'm like, I'm not gonna wish to get sick, but if I'm gonna get sick, this is where I need to be.
That's
right.
It's impressive, right?
I think the last question pretty much is for both of you. Can you give us a real-world example where virtual healthcare saved somebody time, money, or stress, and an improvement you're excited to roll out next?
So I think Yanga might have better examples than me, just because Yanga is Mr. Virtual Healthcare and taking far more calls than I have. But I think the ones that always stand out for me are the ones where, parents call in and they're asking, do I need to take my child to the ER or not? So it's really just that advice or reassurance on something's happened at home, my child's vomited once or twice. Is it worth me taking you in yet, or can I treat at home, and what should I be looking out for? Those sort of cases really stick out for me, because having worked in emergency medicine as well, you also get the panicked parent at 2 a.m, and you kind of feel, I wish someone had taken the time to reassure you that it's all going to be okay.
Absolutely.
You didn't need to wait 3 hours in the ED to be seen when we could have treated this at home.
Yes.
And also to show you what to look for, like Yanga mentioned earlier, all the danger signs, warning signs, to not leave it until the last minute. So that's from my side where we could help from home.
An example, I think one from just this weekend. Weekends it is generally difficult to find someone to see in person. GP practices, and things like that. People go on hikes, camping trips, work around animals. So I can't exactly remember what the details were around this patient, but what they presented with was a rash with a full-size lesion, typical of a tick bite. And there was history that they work around animals. I think yes, they have animals around these school or something like that. And that was, they had nowhere else to go.
Okay.
Do they need to go to an ER for that? Not necessarily. It was very classic. You could see it on the image. We were able to assist them and give them a school.
Amazing.
Yeah, because there is always a clicks that is opened at some point.
At some point, yes. And I think one of the, to answer the last part of your question, is one of the biggest advancements that I'm looking forward to is that, the ability for someone to be able to access everything on CareFirst. So at the moment, we're sending it through email or WhatsApp or however we're getting it to you. But it would be ideal if everything was in one place. So you could click one button to get my script, to download my script, to show the pharmacy, this is what it was, have that sort of thing. And there are some big enhancements coming. I know there's a big release coming out soon to improve performance, which will be good. It's always good to increase your performance.
Yes, absolutely. If people want to now give this a try, somebody who's never experienced virtual healthcare in their life, and they're like, you know what, let's just throw caution to the wind, excuse the bad joke, but let's give it a try. Where do they go?
So I would go carefirst.co.za, and there's a lot of information on there. You'll see Yanga and my face on there, and if you're wondering what we look like,
I'm the guy with the face for radio, just FYI.
And then it'll take you through step by step what's going to happen, and you can give it a go on there if you don't want to do the full consult. www.carefirst.co.za.
Right.
Easy peasy.
Doctors, thank you so much for your time. I know that I sat in on this first chat, but this has just reaffirmed just how amazing this product actually is, and how much I'm not jinxing it by saying I'm looking forward to using it, but I'm looking forward to seeing it in action.
Thank you.
Doctors, thank you so much.
Thank you. Thank you for.
Need trusted insight into the future of healthcare? Join us every Monday at 1:15 p.m. for Medical Mondays on 91.9 FM. Brought to you by First Care Solutions. We unpack real issues with real experts. From virtual consultations to the innovations redefining patient care in South Africa. Stay informed, stay empowered. Visit www.firstcare.solutions for more. First Care Solutions.